So, you're considering selling Medicare health plans. Great idea. But what do you need to know about this market before making a decision? We hope this video helps answer some of your initial questions and point you in a profitable direction. The numbers don't lie. What other insurance market has this type of demographic growth? The 2010 census showed 13 million Americans 65 and older. In 2011, when the baby boomers started to arrive, 10,000 people per day were turning age 65 and Medicare eligible. By the year 2020, 16.1 million. 2030, 19.3 million. 2040, 20 million, and then the growth starts to level out. If you enter this exploding market, you'll have plenty of prospects to sell. All this information is exciting, but let's slow down a minute and quickly overview the different pieces of Medicare. Original Medicare is made up of two parts. Part A helps with in-hospital costs, and Part B helps with doctors and outpatient care. In 2003, the Modernization of Medicare Act created two additional parts of Medicare. Part C, Medicare Advantage, which modernizes original Medicare with copays and prescription drug coverage to act more like today's medical plans. And Part D, the popular part of Medicare Advantage that helps pay for generic and brand name prescription drugs. So what types of products can I sell in the Medicare market? Well, that depends on the client. Enrollment periods apply to some of the products described here. For our current discussion, we'll just stick with a simple overview. A client with original Medicare coverage parts A and B has some choices to make. They can stay on original Medicare and buy a Medicare supplement to cover the original Medicare's deductibles and coinsurances. Now, you're also going to want to complete their coverage with a Part D standalone drug card. Well, they can also decide to modernize their original Medicare benefits and claim so by their rights under the 2003 Modernization of Medicare Act. By selecting a Medicare Advantage plan, these plans are going to feature low to no premiums, copays and coinsurance, preventative care. Prescription drug coverage will be included in these plans. All of these plans are subject to county availability. So how is this possible? Low to zero premiums. Well, first, Medicare assigns the Part B premium to the insurance carrier for management. They will also pay the insurance carrier a per diem by beneficiary enrolled in the program by county. They'll actually double that reimbursement for those that are dual eligible, Medicare and Medicaid were available, or for special need programs for chronically ill people with diabetes, congestive heart failure, or chronic lung disorders. So by assigning dollars to the carriers for benefit management, the system runs more efficiently. Eligibles get more benefits, and the system just runs better overall. So is the selling of Medicare health plans a year-round selling opportunity, or just at certain times of the year? As the 65-plus market continues to explode and new people turning 65 grows more and more each month, the baby boomers turning 65 is a mountain of people, and it's growing rapidly until it levels off in the year 2040. These people need your expertise and guidance. But there are even more opportunities. Due to the new healthcare law, many employers are dropping retirees off health coverage. Many seniors find themselves suddenly without employer group health coverage and need your help. There is some shrinking of the Medicare health plan carriers, and it has gone on for a little while. There will be more as the best carriers will rise to the top. When people suddenly lose their plan to a carrier by no fault of their own, they will need your help. Yes, people do move, and movers are another part of the business. People's lives change, and they move into areas where plans are available to them. It's just another opportunity for you to sell. In certain markets, you'll have the ability to sell plans year-round to people who have dual eligible qualifications, that's Medicare and Medicaid beneficiaries, where they qualify on a diagnosis of a specified illness, diabetes, congestive heart failure, or chronic lung disorders. It is an incredibly rewarding work to modernize and expand healthcare choices for those on Medicare and Medicaid, or those you can offer specially tailored Medicare health plans to and manage their chronic medical conditions. So whether it's turning 65, a special election period, or special need plans, Medicare Advantage is a year-round selling opportunity where available. So what's involved in becoming a certified broker for Medicare health plans? Well, first, contact us for direct carrier contracts and still remain an independent agent. Second, it is required that you carry professional liability insurance. Now, once your contracts are approved, you'll begin the online certification and training process. There are two ways for you to achieve this. You can take the AHIP course and become accredited on several courses to be honored by multiple carriers. The cost of this is $100. Or you could do the carry-only sponsored courses and save the $100, but you'll only be certified to sell those carriers' plans. You can do both. But regardless, you will need to take the carrier product-specific courses to sell any of the plans from any of the carriers. Now listed here is just a sample list of some of the types of courses required and the approximate time you will need to complete them. These courses are required to be taken annually. We call this thinning of the herd, as it takes a committed broker who is serious about the Medicare market to do this. Yes, it is a lot of study and work, but the rewards are tremendous. Most importantly, your contracts and commission payments are direct with the carrier. We do not own your business. So what kind of money can be made in the Medicare market? Well, the money is good, very good, as these products tend to renew and satisfied clients refer their friends and family to you. Medicare supplements paid by the carrier's discretion, but in our example here, $210 for new and renewal for 6 years by this particular carrier is common. Some carriers pay longer. Most carriers advance at least 9 months upon issue of a Medicare supplement piece of business. Now CMS Medicare regulates the commission payment on Medicare Advantage plans. A client new to Medicare Advantage will pay $400 the first year and then $200 on renewal for years 2 through 10. If you are replacing a policy of an existing person on a Medicare Advantage plan, you'll be paid $200 the first year and then $200 a year years 2 through 10. Dual and chronic, those year-round selling opportunities I was talking about, pay the same as Medicare Advantage where available and do so year-round. On the standalone Medicare Part D drug plans, if you're enrolling someone into Medicare Part D for the very first time, your commission will be $40. There's a $20 renewal and is paid years 2 through 10. If you're replacing someone who is currently enrolled in a Medicare Part D plan, you'll receive a $20 commission the first year and $20 on renewal years 2 through 10. Selling Medicare health plans is a growth and renewal business. Each year as you add more and more clients to your base, your income will continue to rise, depending on your good service. There's a lot of help from both carriers and your upline distributors to advertise and market your agency's Medicare services. Nationally recognized product branding gives your agency instant credibility. Turnkey individual and group presentations make sure you hit every sales point and keep you on track. Our community meeting prospecting program show you how to step-by-step use the techniques of our top Medicare seller who places over 2,000 applications per year. We have Turning 65, chronic and dual marketing pieces, free Turning 65 mailing lists where you can specify where you want to sell by zip code or county, and coming soon, special chronic and dual qualified beneficiary mailing list as well. Retail selling programs during AEP to put you in national grocery store chains, pharmacies, and help seniors during the enrollment period. In-person, online, continuing education and training from us will help keep you on track and take full advantage of this evolving market. There are many brokerage outlets you can choose from to represent Medicare health plans. So why S.A. Nichols Brokerage? Simply put, we're part of the largest distribution of Medicare plans to independent brokers nationally. Our field marketing office has won the National Broker Quality Service Award by our anchor company, a nationally recognized carrier, in 2011 and 2012. We have offices from coast to coast, so we can offer you live support Monday through Friday till 8 p.m. Pacific Standard Time. We also offer in-person, online, on-demand, or even one-to-one training. We're always just a phone call away. Ask around. Brokers know us by name. So what are your next steps? Call us at 800-283-0040, extension 110, for your direct carrier contracts with top national companies in your area. Submit the contracts to us for processing with a copy of your license and E&O insurance. Now the carrier will contact you to start the certification and training process online. We'll order your supplies. You advertise, market, network, sell, get paid, and repeat. This is Scott Nichols, president of S.A. Nichols Brokerage, thanking you for taking the time to watch this video. We hope you found it instructional. Feel free to call us with questions or discuss this topic further at 800-283-0040, extension 110. You can get you contracted, certified, and selling soon. Just call us at 800-283-0040, extension 110. Thank you.